I'm sad because me and my kids, I don't qualify for the Obamacare insurance.
And why is that?
Why? Because my income is too low.
You might be surprised by that.
That's why.
Even after Obamacare, people are too poor to get assistance paying for their health insurance.
I'm a sous chef. I'm a chef.
How much do you make per hour?
$13
And you work full time?
full time. I got two kids and me. They're twins. If they're getting sick, I need to take to Reynosa, to Mexico.
Mexico is not far from this border county, near the southern tip of Texas.
Yeah, I was born in McAllen.
Have you ever had health insurance?
No.
That's a common story here, where less than half of non-senior adults have health insurance, the lowest rate in the country. Obamacare was supposed to help cover these people.
I only earn $8,000 a year this year. Why can I not get into Obama health care?
Here's why. Only the poorest in the U.S. are covered by Medicaid. Many adults below the poverty line do not qualify. The Affordable Care Act tried to cover the people in the middle from the top down and the bottom up. Medicaid would be expanded to cover more of the poor, up to 138% of the poverty line. And those making above that amount will get subsidies to buy private health insurance on the new exchanges. But in 2012, the Supreme Court ruled that the federal government could not force the states to expand Medicaid. 26 states still did. Texas did not. So while those above the poverty line can get subsidies, those that fall below have to pay the full price.
I am sent to the marketplace to pay $488.
That was the quote that
Yes, $488
For who?
from my husband and myself. I'm like,
Raquel Calderon works as a home care provider and says she and her husband make about $15,000 a year, just a few $100s below the poverty line for a family of two. She recently fell and dislocated her shoulder. She's paying out of pocket for health care and is having trouble finding a doctor to treat her. You work how many hours a week?
33 hours.
So if you worked 45,
I would qualify.
So those people are caught in between. They're just going to stay the same. Nothing they can do.
The Kaiser Family Foundation estimates that more than 1 million people fall into this coverage gap in Texas alone. And there are almost 5 million across the country, not including undocumented immigrants. Most children living in poverty are covered by Medicaid, even in Texas. And the poverty line changes with the number of people in the household. This creates an environment where a single person working a low-wage job can be above the poverty line and qualify for subsidies, while a mother can be working the same job, fall below the poverty line, and be stuck in the gap.
If I don't have any children, maybe I can qualify for the Obamacare.
But you have children.
Yeah, I have children.
Why won't states like Texas expand Medicaid? The federal government said it would pay for most of the expansion, but the state is afraid it will cost too much down the road.
Some of our friends and allies in the conservative movement have folded in the face of federal bribery and mounting pressure from special interest groups. They tell us to take the money, but there is nothing free. There's nothing free that comes from Washington.
So the uninsured will keep going to medical clinics in the area, funded privately and by taxpayers.
We have a lot of chronic illnesses that we treat, of course, diabetes, heart disease, high blood pressure. Our patients are all very low income. They're what we've identified as the working poor. It's a big misconception that the people who are here are undocumented, and that's the reason that they're uninsured.
We have a lot of people at minimum wage, 7, 8, 9, 10 bucks an hour. So they don't think about health insurance right away.
But health insurance is on Blanca Hidalgo's mind. She says she's a legal resident who has lived in the States for 15 years and needs health insurance.
Rutinario.
Yeah, she's coming here for routine primary care.
Pero si tengo una emergencia,
Some kind of emergency.
el hospital.
Her income is too low to qualify for subsidies. Many of the uninsured in this county live in the colonias, unincorporated towns with rapidly expanding immigrant populations.
It's getting quite big.
Is there a population count?
Oh, geez, we couldn't even guess. We couldn't even guess.
Shirley Arnold runs a local community center with a medical clinic.
We have basic medical needs. Health does not have borders. If we can reach out to the people that have tried to come over here to better their lives, how can they improve their lives if they can't improve their health?
Undocumented immigrants living in this area were not interested in speaking with me on camera, but Jose Canchola would.
I'm a U.S. citizen. Yes, sir.
He works in the fields, and his home burned down just a few months ago.
I know that I need to see a doctor, but I don't got the money, I don't got the insurance money. There's a lot of people that need help for real, besides me.
There's people here that when they don't have the insurance and they get so sick, they're basically told to go home and they end up, just to go home and die. And it's a sad reality.
You're rich, you're gonna die, you ain't gonna take nothing. I'm poor, I'm gonna die, ain't gonna take nothing with me. That's why, just trying to make our life, that's it. In this life, just trying to live for real.
Jordan Malter, CNN Money, Hidalgo County, Texas.